So, welcome to this episode of Menopause Conversations. I'm really pleased to have our next guest with us. I'd like to introduce you to Clare Baumhauer. How are you, Clare?
I'm fine, thank you. Thank you for inviting me.
Oh, you're really, really welcome. I've been following Claire for some time. You may know Claire because her story has appeared in many media outlets, newspapers, articles, and for good reason. And today we're going to break the silence really on a topic that so few people know anything about. We're going to sort of move the curtain to one side. It's about lichen sclerosis, vulval cancer, and the advocacy work that Claire brilliantly does as a result of her own experience. So, welcome, Claire. It's really great to have you here as a guest today.
Thank you.
And so, what we want to do is tackle this topic because it's rarely discussed. So, would you like to tell us a little bit about your background, about your story, and how it is you find yourself talking about lichen sclerosis and vulval cancer at this stage in your life?
Well, it was really I didn't get diagnosed with vulvar cancer and lichen sclerosis until I was 43. I'm 51 now. And obviously, I hadn't heard of either condition. So I was quite angry, really, in all the years that I'd had a chance to get diagnosed and hadn't. So, in that reason, it sort of made me angry in the fact there is little awareness. So, it's why I started doing what I do, run support groups, patient representative on quite a lot of different projects. Try and raise awareness for social media. That seems to be the best way to do it. Because, from the age of about 5 was my earliest symptoms, which I can remember. And that was when, when you're that young, you're sitting on the floor quite a lot, whether it's at school, in assemblies, on hard chairs. And it was really uncomfortable and sore. I was quite itchy as well. Couldn't keep still. So I was always called a fidget and told off by my mum and the teachers. And it was about eight, 8 or 9, my mum could hear me crying in the bathroom because when I was going to the toilet, the urine would sting so badly that it would make me cry. And she'd get saying, take me to see a GP. But, at that age, 8 and 9, I was embarrassed, didn't want to go because our GP was male. I only had one at the time there. And eventually she said, I can't take you crying anymore. We've got to take you to the doctor. So I went to the GP. I didn't do any talking, too embarrassed. So my mum did a talking for me. And she only really knew what she had heard, and that was me crying, going to the toilet. I didn't say anything. The GP didn't ask me any questions or ask to look, just said it was cystitis. So gave me treatment for that, and off I went. It didn't help. I did keep it quiet after that because I didn't really want to go back to see the GP because I was really embarrassed of being of a 9-year-old. And it did sort of go into remission by itself for a few years after that. And it wasn't until I was in my early 20s that it started to come back. My symptoms at the time were just really itchy, especially at night, really sore. Any friction would cause blood blisters and sores and just be uncomfortable. So throughout my 20s, I did self treat quite a lot. I did go to see a GP a number of times, all male. None of them asked to look. I never asked them to look. Obviously, quite embarrassed to even go. And again, they just automatically said it was thrush. They would give me thrush treatment. So I would also continue to self treat. It made a tiny bit of difference, but not a great deal. I'd had 2 children in that time. I'd had 8 smear tests as well. Always came back clear. I didn't have the HPV virus. Everything was always told it was fine. So just thought, can't be anything serious I got wrong. Sort of just plodded along in life. Did find it hard, but thinking I've got thrush, would continue to buy thrush treatments again, would look on the internet, try and find things I could use, pseudo cream, just, I tried everything to really help. Didn't really help. It wasn't until I was in my late 30s that I noticed that a tear that I had, it wasn't healing. And although I'd been to the doctor previously and did actually see a female GP for the first time, and she was the first one that actually looked, and she did a swab, and it came back as I didn't have thrush. She then sent me off for blood tests because she thought maybe it could be diabetes related, the itch. That came back clear. So she then said, oh, it's probably just early menopause, perimenopause symptoms. Off you go. Wasn't offered anything either at the time. Just off I went again. So again, carried on self-treating, ignoring it where I could. And then, like I said, in my late 30s, the tear that I had didn't heal. It was quite a big tear. And again, I ignored it because I'd been to the GP so many times. And in the sort of January of 2016, I noticed that the tear had changed quite a bit to like an ulcer. Again, carried on self-treating, ignoring it, thinking, what's the point in going back to the GP? They're just saying it's thrush, or, so it can't be anything serious. I've had smear tests. And then in the March, within 3 months, the ulcer had sort of grew sort of twice the size, and it got to the stage where I couldn't sit, couldn't walk. I had to go back, so I went back to the GP. Again, I saw another different GP, and it was a female GP, and she actually did ask to look, and straight away she said it's herpes. So she said, get to the gum clinic. And I was quite shocked by that, obviously, because I've been with my husband for 25 years at that time. I wouldn't have gone to a gum clinic. So if the next part didn't happen, I definitely wouldn't be here today. But she saw the shock in my face, I think, and then just said, hold on, let me have another look. So she looked again and said, actually, it could be something else. I'm going to send you to get a biopsy. Please make sure you go. If you don't hear anything within 2 weeks, at the time I didn't realise it was a 2 week cancer pathway, please come back and see me. So I did get an appointment. I had 3 biopsies taken, was brought up quite quickly actually to my local hospital to get the results. Doctor was there, and then a nurse walked in with a box of tissues. So straight away I'm thinking this can't be good news. And that was when I was told that I had lichen sclerosus and vulvar cancer, both conditions I never heard of. That
Goodness.
was also the first time I'd ever heard the word vulva, because growing up, I was always taught as it was a vagina, the whole area, or down there, or private. So getting like 3 shots like that was it was awful.
My goodness. It's so shocking, isn't it?
Well,
And
it is, but it's also not, because it's happening a lot. I'm not the only one this happens to.
no, can you tell us sort of any sort of, I mean, first of all, I want to validate uh, hearing your experience. I mean, there's so much of that that I think so many people listening to this will relate to, that embarrassment, the uncomfortableness, male GPs, don't really, the whole stigma around it, the whole taboo around it, the fact that we don't know what parts of our anatomy are called. We call them our foo-foo or our mini more than we'd call them by their biological anatomical terms. We have a lot of work to do, don't we, to redress this. I mean, yeah, there's a lot to take in there, and I'm sure for you each time, I'm sure it doesn't diminish when you talk about your experience and your story, because that is some experience from the age of 5. Just how is it possible? And for you to say it's still happening, I mean, when we think about lichen sclerosis, do we know what the prevalence is in the
Again,
population? Do we have any idea, or is it because people aren't A, going, B, not being diagnosed? We just have no idea the prevalence.
well, it's like most women's health, it's sort of ignored, isn't it? It's unfortunately it's a condition that's not automatic training. GPs don't always get training. If they do, it's very limited. Nurses don't get training. And that was one of the things that I was so shocked by. When nurses are doing our smear tests, they got to look at the vulva to get to the cervix. And yet they're not trained in vulval diseases. So all them times, all those missed opportunities I had, midwives, GPs, nurses, over those 38 years, um, didn't say anything. And I had all the classic symptoms of lichen sclerosus, which are white, shiny skin. I had tears, I had splits, I had blood blisters. I had a tear during, well, I actually believe I had the tumour during my last smear test, even. But nothing was ever said. And, we don't look at our vulvas regularly to know what our normal is. So I wasn't really aware that, what I was looking at wasn't normal. So I expected that nurses would know, but because they're not trained and many GPs aren't, they're not aware of the condition. They think that it's rare, but we know it's not. It's common. It's just unrecognised disease because of lack of training. Then they're not aware of it, and which is why it's quite often misdiagnosed as thrush or dermatitis, or even now menopause symptoms for vaginal atrophy sometimes getting misdiagnosed as lichen sclerosus, and vice versa. And I think the reason why it's more common to get LS in the older age, which is why it's associated with sort of menopause age, is because this is just my opinion, but it takes that long to get a diagnosis. That's why you're that age. You,
Yeah.
well, I've ignored it yourself because you're embarrassed to go to the GP, and you get to that sort of age where you're a bit more confident maybe, and you go. Also, if you have, the menopause symptoms are probably making the LS worse, so that's making it you go to the doctor at that sort of age because you've got both together. So that's
Yes.
making you go. And obviously, you are misdiagnosed like myself at least 7 to 9 years anyway with lichen sclerosis, and that's why you're sort of reaching that age. That's obviously just my opinion, but that's why I think more are diagnosed around 50 and above. But there are more and more getting diagnosed younger now. And I think that's mainly because of hopefully awareness and training with GPs.
Yeah, there's so much there that I'd love to sort of come back to. I mean, firstly, it would be incomprehensible to imagine that you'd feel anything other than really angry about the way you've been treated. How do you process that on a daily basis?
Well, I think that's why I do what I do because I had to put the anger somewhere during my treatment because obviously it'd been left so long. It ended up being stage 3 cancer, and I had quite a lot of complications. Was quite unwell for quite a long time. My treatment lasted 14 months, so those 14 months of in and out of hospital, on trains, and I was just googling. I was just looking on social media because it was quite big at that time. Social media, sort of 8 years ago, and there was nothing. I couldn't see anything. And then when I found out that smear tests that you're not going to get a diagnosis because nurses aren't trained, all that was just pure anger, and it had to go somewhere. So I just thought, well, then I have to do something. People weren't talking about lichen sclerosus or vulvar cancer because they are embarrassed. Even some in my vulvar cancer group, they don't say they have vulvar cancer. They either say it's cervical cancer or don't say anything because they're just embarrassed. And for that reason, there's not going to be awareness because people aren't going to come out and talk about it more. The same with lichen sclerosus, people are embarrassed, which is acceptable. I asked my family first if they're happy for me to go public because knowing it could affect them as well. Because my daughter was 16 and my son was 11 at the time, and they both said, "Yep, they're proud of what I did." So that was when I first got into touch with the Eva Pill, which is a gynecological cancer charity, and asked them really, "Why aren't you doing more?" And one of the reasons were because no one wanted to talk about it. So that's when I said, "Well, it's got to be me then." So I did. So I wrote a blog for them for their site, and then it just sort of snowballed from there. The papers contacted me, and then my story went viral in 2017, and it sort of continued. Then lots of podcasts like yourselves, and other media outlets, and it just sort of became where that was where I sort of put all my anger, trying to use my experience to help others to try and get more research and more changes done. And every time I sort of want to step back a bit, I just get lovely messages saying thank you. I had one not long ago actually when I was thinking about stopping doing it for my own mental health, really, when someone's husband contacted me and said that his wife had seen one of my Instagram posts and recognised the symptoms, and it made her go to the GP, and she got diagnosed with cancer. And if it wasn't for that, they wouldn't have had the short time they had together because unfortunately it was caught too late. She died within 3 months of that, but he got 3 months more than he wouldn't have got. So things like that just make you want to carry on.
Yeah, I hear you. And it makes you sort of channel that energy and process it in a different way. Because there's so much to be angry about there. I'm just going to reach over and get my Vulval model, actually, because I actually bought a 3D one,
Oh
Claire.
yes, I can see them. They're brilliant. Yeah.
They're brilliant, aren't they? So just for people watching this, let's educate them whilst we're here now. I carry mine in a bag and I take it here, there, and everywhere. And you definitely get a few raised eyebrows when people see it come out. So I'll show it now for educational purposes. So when we're talking about it, here is your vulva. So in the region where you were having symptoms, was it more here, outside, or the whole area?
For mine, by the time I got diagnosed, it was virtually the whole area. My clitoris had become buried, all the
Which is
scars.
here.
The inner labia had shrunk.
So here and here, that had all shrunk away. So very painful, I would imagine, then for walking, because what I always say to people is it's like it's moving like that. And it's really for it's like the lips on our face, isn't it? You wouldn't go out, it's really cold out now. You need some barrier, some protection. And obviously those loss of hormones, and the way that that was being affected would have really exacerbated that. And pubic hair would be around this region, wouldn't it? So actually, if we hold it up sort of like that, anatomically, sitting would be really uncomfortable, wouldn't it?
Yeah. And my cancer was in a rarer area, which is the perineum, which is obviously the
So
sixth.
here, this bit between the skin, a very thin bit of skin between obviously the vaginal opening and the anus. And so this is why women often get urinary tract infections, isn't it? Because obviously E. coli and various bugs living around here migrate and make their way up. And if we've got little cuts and fissures like you were describing, it's not long before they're up into the bladder. Obviously, here's where your urine comes out, and then it's up into the bladder. So so when you said you were self-managing, because we want people to be aware that the self-managing bit needs to be very short term. You need a diagnosis. What were you self-managing with?
Well, I was just trying everything really. I'd pseudo cream, Vagisil, just anything I could get hands on, which was stupid really, because I was making it worse. Because we know now that a lot of the nappy rash creams are good, but long term they could cause contact dermatitis. So I was just throwing anything at it, just trying
Yeah,
to help really. Um,
barriers and lubrication,
yeah,
basically.
the wrong ingredients added in it. At the time I was using quite a lot of wet wipes as well. Again, not realising the perfume side of it. I was doing lots of things that were wrong because I had no idea of the condition and what I was doing
You were
really.
doing your best though, weren't you? You were trying to look after yourself because there is that element, as we know, of we just keep calm and carry on, don't we? Because we've got a million other things that we need to be doing for everyone else, and we sort of deprioritize ourselves. I mean, from your understanding, because you are so knowledgeable about this, what is lichen sclerosis? Is it a bacteria? Is it a virus? What is it? What do we understand by it?
Well, that is the big question because there's not enough research. They don't fully know what it is. So some believe it could be autoimmune,
Okay.
some believe hormonal link, mainly because of the age, trauma as well could cause it or aggravate it. They're not really sure. They know that it's a chronic skin condition, and it affects not just women but men as well. Children and adults as well. It is mainly in the genital area for men and women, but it can be other areas of the body, although that's more rare. But yeah, there isn't enough that they know really, but then that has changed. I've noticed a lot over the last 3 or 4 years. A lot more is changing with women's health. We're getting a lot more funding and getting a lot more help, so they're starting to slowly do more research in it. But the treatment side of it is topical steroids, which is what is the first line treatment. And again, with steroids, there's quite a bad name for steroids, because of obviously a lot of people are scared to use it because they think
Yes.
it's going to cause more problems or it thins the skin. And even
Yes.
doctors are giving the wrong information because they don't know about LS, so they don't realise that that is the go-to treatment and it works. There's been loads of research in it. It works long-term. Use for lichen sclerosus is safe. The vulva is different to the other parts of the areas of the body. For example, with eczema, there are side effects in thinning of the skin because it's on the face, it's on areas where, that can happen. Whereas for lichen sclerosus, if you use topical steroids correctly, in the right areas and the right frequency, that, it's not going to cause all these side effects, it doesn't cause thinning of the vulva skin. And that's, I think, the main problem that we have, where sometimes doctors will give steroids for a patient because they don't know enough about LS. They're only saying to use it for 2 weeks, or they even give a warning, if in the skin, be careful. But
Yeah.
that's not true with LS, and that's one of the problems that we're having, especially in the support groups, where people don't realise. And when they've got different doctors telling them to do different things, it's hard.
Yeah, because we're so vulnerable, aren't we? We're just desperate for someone to guide us in a way. It's like we're not experts ourselves to help me out, but they're not experts either, are they? They're generalists, and what we need is better education. And I know you've done some great work in terms of tell us a little bit about some of the resources that you have that can help people understand. We're going to put Claire's stuff in the show notes because her resources and her link tree is phenomenal, and I totally advise everyone to take a look at it. But what sort of things have you got that people could be doing a little bit further reading, taking a look at that will help them go, okay, now I know what I'm looking for?
Well, originally there was things like DermNet, which was a great source to get information. But recently we've just launched the LS Guide, which was led by Bristol University, and it's led by Dr. Sophie Rees, who's a
Yes.
researcher, and also consultant dermatologist Caroline Owen. They're the two main ones, but myself and some other doctors are all involved in getting this resource, which is a web-based resource, but it's called the Lichen Sclerosus Guide. The website is lichensclerosusguide.org.uk, and it is brilliant. It's got over 20 sections on there, and it tells you what LS is, so you can understand the layers. It tells you about the vulva and anatomy. It's just the treatment. It's just everything on there. That is now really, I think, the best place to go. You've also got the BSSVD, which is the British Society of Study of Vulval Diseases. They do a lot as well, and they help fund
Right.
this. And that's really where health professionals need to go, because you can become a member, and they have training days. I was involved in one last year, and where doctors can learn about vulval diseases, about lichen sclerosus, how to diagnose it, how to treat it, because it's not easy to diagnose lichen sclerosus. It's definitely not always easy to treat either if you don't know what you're doing. But having that resource there is where health professionals need to go, really, so they can understand the condition and help their patients.
Definitely. And I would say that actually, as a result of watching and reading about your story, I did have to go to a doctor last year, but it was only because I'd read your story that I said to my husband, I'm not sure, I want to get something checked out. And I went along to see my British Menopause Society accredited specialist. And I just got over my embarrassment because I just thought, actually, if I can't do this, how on earth can I advocate other women to do this? And one of the things that I was going to ask you is how different does it look on different textures and tones of skin? I'm partly Asian, Claire, so obviously I've got a sort of darker skin tone. What does lichen sclerosis look like if you are a black person, an Asian person? Does it look still like that white shiny, or can it look different based on your skin tone?
It can look different. Normally, it's more whiter. So that's when sometimes it can get misdiagnosed as something else because of, vitiligo, for example. It's just, yeah. So that's the only difference, I think, is that side of it. But DermNet is a great place because you can get photos, pictures on there, and it shows
Brilliant.
skin colours as well. So that is a great resource if you're a health professional as well as patients. We can look at it as well. The more work needs to be done in that, and they are trying to do that now actually to get more pictures of vulvas in different.
Yeah, and I think people like Dr. Nagat Arif have really called for that, haven't they?
Um,
In her own book, The Knowledge, she actually had illustrations done to represent different people, different skin tones, different skin types. I mean, one of the things I would say is actually we just need to get comfortable doing daily sort of MOTs on ourselves, don't we?
we're
We need
told
to
to check
get
our breasts, aren't we? But we're not told to check our vulva.
Exactly. And we don't need, you don't need to be on HRT to be doing that. If you've got even sort of like a moisturizer, if you're using anything like that, actually feeling for little lumps and bumps, feeling for areas of sensitivity. I mean, my husband always says to me, I know when you've been looking at your vulva because the mirror's at a certain angle in the bathroom. And we really laugh about it. He won't mind me saying that. He always says, I know you've everything okay? He always says to me, everything okay? Because he knows that the angle that the mirror has been left at, because I don't remember to put it in its normal angle. So that's how often I do it because I think I just had a little follicle or something here came up. And, obviously as our skin tone changes, we get block follicles on our face, don't we? And a little lump came up and I just thought, I don't like how that feels. I'm gonna go. And even on the 5 minutes as I was in the waiting room, I thought, do I ask her? Don't I ask her? Do I ask her? Don't I ask her? And I said, I'm so sorry. And even that, I shouldn't be apologizing, should I? I shouldn't be going, I'm so
I think
sorry. Can
that's
you
the main
take a look?
problem. Quite often it takes so much courage for somebody to go to their GP that they might only get that one chance to get it right. So if a health professional gets it wrong and misdiagnoses with thrush or something else, then that person might not go back again because it takes
No.
a lot. We know that even from smear tests, the upkeep on that is quite low because it's awkward, vulnerable, and you're embarrassed. And it's no different to having your vulva checked by a health professional. You are embarrassed, you feel vulnerable. So knowing that you've only got that one chance really, and it's frustrating that health professionals aren't aware of lichen sclerosus, even sometimes vulva cancer, especially with the age thing. I don't know why health professionals are so fixated on ages. Forget
Mm.
that it's more common in a particular age. It's just anyone can get it. Vulvar cancer, although it is more common in much older ladies, even I was only one of 43 getting diagnosed at my age, but someone in the UK has been diagnosed between the ages of 0 and 4,
Oh my
according
gosh.
to cancer research. So that is, that is extremely rare. And the youngest we have in our support group was 17 when she was diagnosed with vulvar cancer. Again, extremely rare, but it happens. So for health professionals to say to somebody in their 30s and 40s that, oh, you're too young, it can't be
It's
vulvar
that
cancer.
whole gaslighting thing, isn't
Yes,
it,
you
Claire?
can't
It's
say
that whole
that.
dismissive, if you don't know, don't guess, test.
Yeah.
And all of, I mean, I found my own sexual health clinic to be amazing. They diagnosed me with perimenopause when I got nowhere with my own GP. They were amazing every time I thought I had thrush. They actually diagnosed that I had something called cytolytic vaginosis, which you may know about, which is you just get, we're told by anyone who'll tell us that lactobacillus is really good for you and it keeps all your lubrication throughout your reproductive life. But actually, sometimes those ratios can change and it can get out of control and cause horrible symptoms that totally mimic thrush. Now, I was self-treating, as we do, with thrush medication. And only when I just finally just thought this is not working and went to the sexual health clinic that they went, no, you've got something else, because they did the microscopy. They had a good look because that's their field of
Yeah.
specialism. And we gotta shore up the gaps somehow. And you're doing an amazing job of doing that. And I think what starts with is us being comfortable, going, that's now not my normal.
That's
So
right.
knowing what your normal is and
Yeah.
now going, now that's not my normal, something's changed. And in the same way, if you got a blister on the side of your mouth or an ulcer inside your mouth and it wasn't healing, you'd go and do something, wouldn't you? Or you'd prioritize it. And I think we've got to send a message about that. Women prioritizing their health. That, we've got to keep moving forward. And the resources that you've got are excellent. I've taken a look myself. And like I say, you may not have known until we met today, but you had massively influenced me going, no, I'm going to get on, I'm going to go, I'm going to make the car journey and I'm
I
going
think
to
you're
go
right. I think
and
you're
ask
doing it
it.
right.
So,
Yeah.
so my husband even reminded me of that this week. He said, do you remember you had that thing last year? Because he knew I was going to be interviewing. And he said, it was around the time that we saw the lady in the newspaper. And so it is powerful, what you're doing. You may never know the millions of people that you've positively affected. And I would consider myself someone who's educated in this space. I understand. I still feel all the things that you were talking about. So keep going, Claire. You're doing amazing, amazing work. So, you're smashing down the taboos. How is it then that you set up this amazing community? Tell me, you've got 13,000 members in your Lichen Sclerosus group. I mean, what's that like? Is that a real great environment for people to feel supported?
It is. Sport groups aren't obviously for everybody because sometimes, you're hearing the worst case scenarios of what everyone's going through. So it can affect quite a lot of people's mental health. So some people just dip in and out
Yeah.
because we don't often hear all the remission side and the good side of it. It's always the bad. And unfortunately, with some support groups, anything is allowed and they're promoting wrong information, dangerous information. So just
Disinformation and
yeah,
disinformation.
just be
Yeah.
aware if you do join any support groups for any conditions, really. Just make sure you talk to your doctor and you do your research on whatever they're talking about, because yeah, sometimes they are giving the wrong information. But for us, yes, we're all obviously as a lot of us, which is sad. But again, glad they found us because I put in obviously all the resources that I have, all the help that there is there, because quite often they join a group and still haven't seen their doctor either. They think they have LS, so they're joining the group to find out more. So it prompts them to go, and also it makes them advocate for themselves because you won't believe that the amount of doctors still aren't looking. You go to a GP or any health professional with symptoms of the vulva, they should look. If I went in and said that I've got a cut or my leg's itchy, I've got a rash on my leg, they would say, let's lift your leg, let's lift your trousers up, whatever, let's have a look at your leg. Why not do that to your vulva? And you can't have phone consultations either. You can't see the vulva on the phone. So just making them really, be more stronger in saying, no, I need you to look, I need to come in and I need an appointment. And also, if it's obvious that the GP doesn't know enough, then, demand to be referred
Yes.
to prefer, again, it's because it's a skin condition, it really needs to be, I think, a dermatologist, but some are going to gynecologists. It depends if they got a vulva clinic and they know about LS, because even sometimes they're not, trained well and given slight wrong information. So just make sure, that you are referred. Some, unfortunately, the same with menopause, are having to pay privately because the waiting list now for both dermatologists and gynecologists of up to a year. Again, you mentioned about sexual health clinics. A lot are going there now because you can walk in. You haven't got to make an appointment because, again,
You
trying
can
to get an
self-refer, can't you? You can just phone up
appointment.
yourself.
And sexual health clinics now are doing great with LS. They're recognising the symptom signs no more than GPs do. So yeah, a lot are going there because it's a lot quicker and waiting. So it's just making sure that you're getting all the help and advice, and that's why I think support groups can help, because you've got other people that have gone through the same as you, same as the vulvar cancer group. Quite often, once all your treatment ends, that's it. You're just left on your own, and that's when the impact affects you. And you got Maggie's and you got Macmillan's help, but having those that are got exactly the same cancer, the same side effects, and the same problems that you have, it makes a big difference. That helps me having others to talk to, because it's a very lonely place having a condition like lichen sclerosus or vulvar cancer, because there's a chance that you won't know anyone else with it because you were not talking about it.
Yeah.
It's only like what I do that when I started to share my stuff on my own social media, I actually got somebody that lives 5 minutes away diagnosed with vulvar cancer, because one of my other friends shared it. She saw it, went to the doctor. So, and other people just talk to each other about lichen sclerosus. And even family, they're not telling family about it.
No,
Which is,
no.
why we're not going to find out yet if it's hereditary or not, because families don't discuss it. And having a support group, they think, oh, maybe I will. When they finally tell their mum or their sister or their auntie, and they turn around and go, oh yeah, I've got it as well. But they haven't
I know.
discussed
It's the ripple effect. It goes from a ripple to like almost like a tsunami, doesn't
it.
it, Ben? And that is the power of, I often say, listen, I'll take all the vulnerability, I'll take all the embarrassment so you don't have to. But you know what? We cannot not talk about it. It is just that's too it's incomprehensible. The more we talk about it, the more we understand. So I've got a question that just popped into my mind there then, which is, so obviously let's imagine you're going through people going through perimenopause, and we know that obviously bodily fluids, lubrication will change, when we start to lose that progesterone part of our hormone complement. We've got three hormones: estrogen, progesterone, testosterone. Progesterone declines first, quickly followed by estrogen. What is the connection? Is there any connection in terms of how our symptoms would progress with lichen sclerosus as we go through the perimenopause? Does it accelerate it, Claire, or is it possible to have any estrogen back to re-estrogenize those areas to support the integrity of that skin in that area? Do you have any thoughts on that?
Yeah, that's quite important, really, because like I said before, most people that get diagnosed are in menopause already or perimenopause, and that's probably because they have both lichen sclerosus and they're getting the menopause symptoms. Lack of estrogen is causing similar symptoms because they are similar. Quite a lot of symptoms. You're losing your structure, you're getting the sore burning. You're getting quite similar. Um,
Mm.
Putting both together, obviously, it's making it twice as bad. So, that's why I think more are getting diagnosed at that age, and also getting misdiagnosed with one or the other, because obviously I was told that my LS was menopause related. At that time it wasn't, but now it is, because obviously my cancer treatment put me into instant menopause at 43. I then was whoosh, all the menopause symptoms all came at once, and so yeah, that affected the vulvar tissue and affected everything. So I was put on estrogen, Vagifem, and also cream for the outside. So that's
Yes.
important. Obviously you're aware of lack of GP knowledge with menopause as well. So that side has got to be tackled first. But there is hopefully, touch wood, some research that might be happening soon. I've been speaking to a doctor who is looking at using estrogen as a treatment for LS, because originally it was just as an extra. It's
Yeah.
not a treatment for LS, it's just a treatment for menopause vaginal atrophy, but it's going to help because it's got similar symptoms and it's helping, what's
Right.
so, but she's starting to think, can it be a treatment, not just as well as, but can it
An
be a treatment?
actual active treatment for it.
Yes, so that is something which is quite exciting. So hopefully that will happen in the future to find out not just as a it help, could it be a treatment as long as alongside steroids as a treatment to use it because they are noticing that it's helping
I
because
mean, I definitely found myself, I'm quite sensitive to estrogen systemically. I can't have a lot of it because it makes my histamine go haywire, which is part of your inflammatory response. So I get a whole other raft of symptoms. But I think for myself, it is a game changer having things like the Ovestin cream, which is such a
yeah,
micro dose. That's why we don't
that's
call it
the one.
HRT. It's just called
Exactly.
localized estrogen. But having that here literally re-establishes that plumpness.
And that's what
And
that's
with
what
that,
it's about. Yeah.
it just feels better, doesn't it, Claire? That actually, and things move a little bit better. It's not as thinning. And what we got to remember is, I remember Dr. Aziza saying this, that, I think we've got to get out of the mindset that, oh, it's plumped back up now. I'm all right. And you stop with the cream. No, you need to keep on with these things because you've lost your own supply of your hormones because through the natural aging process, but actually for your comfort and your well-being, it's really, really important. I mean, so many people don't understand how painful it is to sit if you've got vaginal atrophy, let alone blimmin' walk, and forget riding a bike. Totally out of the question. The reality is there's so much we can do to restore people's levels of comfort, and it's so distracting, isn't it? That constant nagging, gnawing sensation. So what I would say to people is, we know that Diane Dancerbrink's amazing booklet as well talks about genitourinary syndrome of menopause. And there's two important things there, genito and urinary. It's really talking about everything here. Um, Start getting some tracking of your symptoms. You were very good. You've given such a comprehensive overview of all the symptoms you're experiencing. I think it's like know you're normal. What are the symptoms? And actually have a short window on self-managing. Get yourself checked out by someone, and not to be put off. If it doesn't feel right, give us some tips, Claire, for about that advocacy for yourself, because a lot of people will just go, oh, okay, I'll go away then,
Yeah.
or
Yeah,
I
no,
feel like I'm bothering the doctor.
you need to see what your normal looks like to start with. So just check in, even if it's just once a month, you're checking your vulva like you would your breasts in the shower afterwards. And so you know what's not normal for you. And then if it's there, whatever you've got, if it's a tear, a spot, a lump, anything's happening, if you still continue to get that for a good 2-3 weeks, then go to your GP. And actually, we've got on the LS guide, there are 2 printouts. One of them is for checklists of vulva cancer,
Amazing.
them off because quite often when you go to a doctor you're embarrassed or you forget your questions or you forget what they've told you when you come out. This gives you literally the list of all the symptoms of LS that you can have. Also, if you open it up and you print it off, also for the doctor as well to look at because it helps them as well.
Yeah,
um,
massively.
there's also a diagram on the back which is of a vulva, so you can if you're embarrassed, it's easier to point and say, I've got symptoms here.
Excellent.
And then at
Excellent
the same
idea.
time, with their treatment, there's also another one which you can print off, which is for treatment. So it shows you how much steroid to use, where to apply it, because we don't often know. That's also got another diagram as well on that.
Yes.
They can point to exactly where you need to put the steroids, where they can see active lichen sclerosus. It can also help with estrogen,
Amazing.
applying that because they just give you these creams and don't often give you the right information of where and how much. So take them with you because that only takes a bit of the embarrassment away because you've got it written down so you can point rather than say, I'm itchy, vulva, or you
Yeah.
embarrassed.
Or can't quite remember because there's a lot of V's in that area, isn't there? Like your
Yeah,
vagina,
yeah,
your vulva.
yeah.
It's like which so that is inspiring
It
and
is.
really so
For
simple,
me,
isn't it?
the amount of times, I did blame myself in the beginning because I said, why didn't I tell the doctor to have a look? Why did I use the wrong wording? Why did I say vagina itchy? Why didn't I say vulva? But then I thought, actually, no, I'm not going to blame myself because the doctor should have asked to look. The doctor should have used the correct words. I should have been taught at school that it's a vulva and not a vagina. So, and that's part of what we try and do with the awareness on social media, is to make sure you use the right words, just to stop trying to be embarrassed, you know. And that is something which I'm quite passionate about, because if I had known I had a vulva and used the word vulva, then maybe I might have not been told it was thrush. If we weren't
Yes.
so embarrassed, then I might have said, "Well, you're going to have a look," you know, instead of playing. He didn't ask to look, you know. So
Yeah.
just don't be embarrassed. I look at them all the time. Just make sure that you know that you can't have these appointments over the phone either. You need to be seen, and you need to have regular checkups, because lichen sclerosus, although it's a very small risk of cancer, between 3 and 5%, and mainly that's somebody like me that's been misdiagnosed and not treating it for years. But there is a small risk, so just make sure that you have regular checkups after. If you know, if you're not happy with you've got to with seeing your GP because you don't think they're knowledgeable enough, then send them the S guide, send them the BSSVD website. You know, ask them to
Good
take a
shout
special
out.
interest and,
Yeah.
like, you know, and do these training. Go to sexual health clinics, ask them to check once a year. If you can save, you know, £10 a month over the year, that will pay for a private consultation with a consultant dermatologist to get checked. That should happen, but unfortunately, you know, the waiting list is about a year. But just, yeah, just take charge of your own health, really.
Yeah, I really love that, and shouldn't have to be like that, but it is what it is, and we got to prepare people in that way. So tell me a little bit about how things are for you currently now. Do you feel you have a better level of care around you, Claire?
Since I, yeah, well, so since I got the diagnosis, my team is a gynecologist, oncologist, and a consultant dermatologist, and they've been excellent. I am seen regularly. The side effect side of it was a bit of a struggle to start with, because you are left, although you have 3 monthly and 6 monthly checkups, you're sort of left with all the side effects. So obviously I was put into instant menopause, so I've had to get around all that. That's how I found Diane, actually. I'm on
Yes.
social media a few years ago, so I knew I was on the wrong HRT, so that side of it finally sorted. I was also left with um, lymphedema in my left leg, pelvis, abdomen, and vulva as well, because of the radiotherapy caused that. So it's dealing with all that. That took some time. Again, waiting list. I took a year before I got seen to get that sorted.
And what are the symptoms of that?
Sorry, it's swelling because the lymph nodes were removed, and also I had radiotherapy in the area where the remaining lymph nodes are, and that's lymphatic system is what moves all the fluid around
It
our body.
drains, it takes the
Yeah,
toxins
and
out,
also
takes things out. Yeah.
it helps with infection. Most of the time, you don't know you've got an infection because it's fighting for you. And because of that was damaged and blocked, I now get swelling in all those areas. So, as well as having vaginal atrophy, menopause, thank you, lichen sclerosus, the vulvar cancer surgery, I now have lymphedema in that area as well. So, having multiple conditions in that area is obviously it's life changing. It's hard. And obviously, having one leg bigger than the other means clothes and pain, and having to wear
Oh,
compressions, having to wear compression pants when you've had vulvar surgery, when you've had uh, pelvic radiotherapy, when you've got lichen sclerosus, when you've got vaginal atrophy. Obviously, what helps one condition is making something else worse. So it's hard day to day. But you know, I have got a great team now, and I am seen regularly. I'm seen every 3 to 4 months. Unfortunately, in 2023, my cancer came back. It was on the opposite side, so it wasn't in exactly the same place, which is a good thing for me. Um, I had to have more surgery, so that was my fifth surgery at that point. And currently got my yearly scans and MRI due June, July. So hopefully, touch wood, I'll be saying that I'm 2 years in remission again. But obviously, dealing with all the side effects from the bowels and the bladder, it's hard. But you know, I just got to remember that I'm still here. And although at first I ignored, you know, the quality of life, because I got to be pleased I'm still alive. Thanks to Diane helping a lot with the menopause side of it, I started to think, you know, my quality of life is important. So I started to do a lot more, you know, in helping myself really, and trying to navigate all the things I can do.
yeah, you're so inspiring. Um, because you keep on keeping on. And you're right. I mean, it's not one thing gets fixed and then let's fix the next thing and then the next thing. It's such so finely integrally balanced, isn't it? And tell me, I mean, you've got children. I mean, you've already made a difference, probably educationally for your daughter. Um, what's your hope in the future for her generation?
Well, hoping that they actually talk and say more about their bodies, and talk about vulva and vagina without getting embarrassed, which I've noticed actually the younger generation are a bit better
I think
than
you're
our
right.
old one. And it's just talking about it really. I would love it if one day you could talk about your vulva and your vagina like talk about your nose and your ears, and we don't whisper and taboo, and get embarrassed. That's what I hope really, and that there is more awareness around our body and that we do go to a doctor when we have got problems.
I think that's absolutely amazing. So tell us one thing that each of us can do. If we're watching this video and we've listened to your story and your experience, and actually it's mirrored largely all across the country because there just isn't enough awareness. What's one thing that we can each do literally immediately today that
Well,
you would
I
advocate?
think I have to say two things rather than one. One
Go
is
for it.
check your vulva. Make sure that you check your vulva, and get to know you're normal. And the second thing is, please just tell one, even if you tell just one person about checking your vulva or lichen sclerosus vulva cancer, because you could save someone's life as well as make their life better. Because just from me being on, I was on the radio a few weeks ago, and the amount of people that have tracked me down on Facebook and found me and said, I recognise them symptoms, I've made an appointment to see the doctor. So just by seeing or hearing about these conditions, this light bulb moment for people are thinking, actually, maybe I haven't got thrush. Maybe it is lichen sclerosus, and they're going to a doctor. And you've helped that if you've told that one person about these conditions. Don't be embarrassed, just talk about it.
I love that. I think that's so true. And I think it's what I do think women are good at that. We do talk about stuff. It might take us a little bit of time to warm up, but once we start, you can't shut us up. So I think that's great. And actually, I'd also advocate take someone with you. Like, often like my husband's great. He always came to every appointment with me. But if you've got a girlfriend, someone who you feel trusted, someone who makes you feel calm, and when you lose your words or can't think what you're saying, obviously you got your leaflet and stuff like that. But take someone who makes you feel okay with you, because that's all right, isn't it? We can't be expected to reel off everything and we will forget things, but if we've got someone there that we trust, they'll help us out, won't they?
Yeah, yeah. I did just take my husband with a lot of my appointments, but then I banned him from coming because he was either asking stupid questions, or I remember one of the times I was behind the curtain, stripped from the waist down, and there was my surgeon, my dermatologist, the nurse, and my husband all talking about tennis because I think it must be doing Wimbledon. And I'm like, they're thinking, "Hello, I'm waiting here.
Anybody there?
Waiting for me to get changed," and they're all talking about tennis and Andy Murray. So no, it's not coming anymore.
Yeah, you have too much of a good time. It's not about you, remember, it's about me. No, I love that. And maybe do just, I mean, tell us about family, how integral your family have been for you in terms of support. I mean, it's wonderful that you sort of said that you asked their permission, which I think is so gracious of you. What does family mean to you?
Yeah, it's brilliant. My daughter's now, she's 25, about to leave home. She's obviously she supports me quite a lot and is very proud. She shares a lot of my stuff on her social media and with her friends as well. My son's slightly different. He's 20, but he's got autism.
Yeah.
He does understand a lot of it. I didn't tell him to start with, but then I had no choice because of the treatment was prolonged. But he did make me laugh the other day because when I was going up to London to do the BBC radio show, I told him where I was going, and he just turned around and said to me, if I Google my name, that's meaning my son's name, he says, do you know what it comes up? It comes up with me, and it says I have a itchy vagina. It did make us both laugh because when I first done newspaper, like clickbait, they worded it wrong and said
Yeah.
it's vagina instead of vulva, and they asked for pictures of family. So obviously, because he's on it, when he Googles his own name, it literally came up with that, with the headlines "itchy vagina," and luckily he finds it funny. But yeah, and yeah, they're very proud of me. My husband has been a rock because any diagnosis of cancer, let alone one in that area, sometimes the relationship breaks down. Happens quite a lot in the lichen sclerosus support group. Quite a lot of the amount marriages and their relationships have ended because sex is difficult or impossible, and mental health problems, keeping it quiet. Some don't even tell their partners they got it.
No.
So having someone like I had my husband, which was, makes me, do what I do as well. Because I do spend a lot of time on doing what I do. I can only go back to work part time because of all the side effects I have. But the other part time to that is what I do.
Yeah.
And he's very supportive, and I can't ask for anything better.
Yeah, and I think we share that. I'm really lucky too. And I think partners can be instrumental in helping us understand what our normal looks like. If we have a level of intimacy with our partners, obviously they may see changes before we do. And I think that's an important part of it. I mean, what do you do for your other part of your work? What gives you joy, Claire? What gives you, I know your work is really in this space is really empowering, but you as you, I know it's you're inextricably linked to your lichen sclerosis and obviously your cancer diagnosis, but actually you as a human being, what gives you joy?
To be honest, it is this because it's just I work in retail, so it's just part time. I enjoy that. It's being with family, and doing things with family. But to be honest, it is this because I'm a patient representative on quite a lot of projects. Even there's one which is called the Pearls Trial, which is to do with steroid treatment. That's been going on for a few years now, and it's that really. I just love it. I just it's choice for me to do it. I do put a lot of time and effort into it, but that is what I do. Unfortunately, that is like hobbies now. I haven't. It's just this. It's just reading. I'm given stuff to read and to review, and it's just that's what I enjoy doing because I want things to change. And I've had to get the NHS to change things on their websites because they had vulva cancer missing off of
Yeah.
HPV information, for example, and in HPV in vaccinations, it was missing. So just finding things that I can change and alter, I just get joy out of that. So that's what I
Yeah,
do.
making a real difference. And I'd say to anyone watching this, if you've got a lived experience of something, do consider being a patient expert on your topic because do you know what? That is how we train people. So if you are living with a condition, even if you feel it's just you, but you researched it, you know a lot about it, your experience and knowledge is hugely insightful. Claire and I were talking just before about research that we're both sort of involved with, and actually, patients' voices can be the difference that makes the difference. It's all very
Yeah,
well looking down microscopes and looking down things, looking at data and statistics, but actually nothing replaces a lived experience. So
yeah,
if you're listening to this interview and you're experiencing lichen sclerosis, vulval cancer, or both, please make yourself known. Do think about joining Claire's group because it's amazing. So Claire, we're going to put all the information where people can find that the LS guide looks phenomenal. And like I say, your link tree is literally heaving with great resources, great videos. You've done a lot of educational stuff and podcasts and things. Um, Please keep doing your brilliant work. You're changing more people's lives than you probably realise. Definitely made me stop and think. And I hope today's interview stops other people and makes them think too. So for now, Claire, thank you so much for your time and look forward to making sure we get this message out to people.
thank you.